You may think your pregnancy is going well. You don't feel anything unusual. No pain, no bleeding. But what if something serious is quietly developing? Something your body hasn't fully told you about yet? A high-risk pregnancy isn't always obvious, but when it strikes, it can bring devastating complications, from preterm birth to emergency C-section to even losing the life of the mother. If you don't know where you fall, low risk or high risk, you might miss the critical window to act. And the price of that delay could be a life-changing regret. In this video, you'll learn how to tell the difference, and most importantly, you'll find out where you fall. Watch closely because what you learn today could protect your baby, or even save your own life. 1. What is a high-risk pregnancy, and why is it more dangerous than most people think? Many women assume only people with chronic illnesses have high-risk pregnancies, but in reality, any pregnancy can turn risky, sometimes without warning. A high-risk pregnancy means there's a greater chance of complications that could seriously harm you or your baby. This includes things like preeclampsia, preterm labor, placental problems, or needing an emergency delivery. So how do you know if your pregnancy is actually normal or a hidden danger waiting to unfold? 2. What makes a pregnancy become high risk? Did you know that if you meet just one of these conditions, your pregnancy may already be considered high risk? You're under 17 or over 35 years old. You have diabetes, high blood pressure, kidney disease, or a heart condition. You're pregnant with twins or used IVF to conceive. You've had previous pregnancy losses, ectopic pregnancy, or premature birth. And sometimes, a woman with no medical issues at all can still fall into the high-risk category. So does that mean every twin pregnancy is high risk? 3. Are all twin or IVF pregnancies considered high risk? Yes. Carrying more than one baby or getting pregnant through assisted reproductive methods like IVF automatically increases your risk. Why? Because of higher chances of premature labor placenta complications, gestational hypertension, and preeclampsia. Even if you feel totally fine, your body is working much harder. But what if you're only carrying one baby? Can your pregnancy still be high risk? 4. Can a single baby pregnancy still be high risk? Absolutely. Just one baby doesn't mean you're in the clear. Many women with a singleton pregnancy still face serious complications like fetal growth restriction, low or high amniotic fluid, placenta, previa, or umbilical cord issues. The scary part? These problems often show no early symptoms. They're only caught through ultrasounds and prenatal monitoring. So, can a pregnancy start off low risk and later become high risk? 5. Can a low-risk pregnancy turn into a high-risk one later? Yes. And it happens more often than you think. A woman might start her pregnancy with no issues, but by the 3rd trimester, she suddenly develops high blood pressure, swelling in the hands or face, symptoms of preeclampsia or gestational diabetes, or she begins spotting or notices the baby's movements have slowed. This is why ongoing monitoring is so critical, not just early on, but throughout all 9 months. But if you do become high risk, what should you do to stay safe? 6. What should you do if your pregnancy is labeled high risk? First of all, don't panic. High risk doesn't mean doomed. It just means your care will be more structured and more closely watched. You may need more frequent prenatal visits, extra lab tests and ultrasounds, a personalized diet and rest schedule, potential early delivery planning or hospital monitoring. But what if you're scared of being told something's wrong? Should you keep symptoms to yourself? 7. Should you hide symptoms from your doctor out of fear? Absolutely not. Delaying care or downplaying symptoms can lead to irreversible damage for both you and your baby. Something as small as a persistent headache or light bleeding could be your body's warning sign. Ignoring it won't make it go away, but catching it early can change everything. So what signs should all pregnant women watch for, even if their pregnancy seems normal? 8. What are the danger signs that mean you should see a doctor right now? Whether your pregnancy is low risk or not, certain symptoms mean you need urgent evaluation. Severe abdominal pain, especially on one side. Heavy vaginal bleeding. Fewer baby movements than usual. Blurry vision, headaches, or swelling in the hands and face. These may be signs of something progressing silently and dangerously. So, now comes the real question. Are you really in a low-risk pregnancy, or have you just been lucky so far? Final message and call to action. Pregnancy can be one of life's most beautiful experiences, but it can also be full of unknowns and risks you might not see coming. Knowing whether you're in a low-risk or high-risk group is the first step to protecting yourself and your baby. If this video helped you learn something new, leave a comment below and share it with a friend or loved one who's expecting. It might just save a life. And don't forget to subscribe, because in our next video we'll talk about the 6 warning signs of preeclampsia every pregnant woman must know. Thank you for watching, and take care of yourself, Mama.